Hi, lovely viewers, welcome back to my channel. This is Talk with Amma, your holistic health and wellness channel. Today, we are going to look at vaginal discharge. Yes, it's a really sensitive and a topic that people don't really feel comfortable talking about. But today is a day that we are going to look at all the vaginal discharge, what it means, the types of discharge that comes throughout your cycle, whether it is infected, when to head to the doctor, so much more. So if you want to learn more about this, don't go anywhere. Do stay tuned. So first things first, let us put it at the back of our minds that vaginal discharge is absolutely normal and it varies throughout our cycle. So don't assume or make a mistake that anytime you're having some discharge, then it's a form of infection, okay? So remember this. Consists of, cells and bacteria from our vagina, our cervix, our uterus, okay, and is a way of the vagina cleaning and lubricating itself. A normal vaginal discharge in a reproductive age female is about 1 to 4 ml of fluid, and that's within 24 hours. So the fluid is mostly secretions from our cervical and even vaginal transudate in combination with the dead epithelial cells and the normal vaginal flora like the lactobacilli, which maintains the acidic nature of the vagina to kill pathogens. So imagine cleaning or mopping a room. You have this water that you squeeze the mop inside and all that. When you're done mopping, do you keep the water in the room or you throw it away? Yes, same as the vagina. So as it's cleaning and doing all that magic over there, the water that it uses to clean and mop is what it brings out as discharge. Okay, so it's normal. It's a way of the vagina cleaning itself. There are some factors, okay, that occur throughout our cycle that can make our vaginal discharge more noticeable. So when you're ovulating, it will be more noticeable. When you are engaged in sexual activities, when you're having a menstrual flow, what else? Pregnancy, when you're taking in some pills, birth control pills as well, it can make your vaginal discharge more noticeable. We'll look at these factors into details later in our next video. So for now, we are just going to look at the different types of vaginal discharge and what it means. Right. So the first vaginal discharge that I want to talk about is the white discharge. Okay. So this is a really common type of discharge. Is common in the beginning and the end of your menstrual cycle. Okay. It is absolutely normal. What is abnormal is when you're beginning to feel some form of itchiness or it comes with some sense and discomfort. Then this one is not a normal vaginal discharge. Okay, it can be a yeast infection. So when it happens like that, head to your pharmacy, head to a gynae and let them prescribe some medications for you. It's not supposed to be itchy. White discharge is normal, but it's not supposed to be itchy. It's not supposed to have any fishy scent. Sorry. Okay, so the next discharge that I want to talk about is the clear and the stretchy type of discharge. Okay, so it's the stretchy, and normally this one will notify you that you are ovulating or you're in your fertile period or window. Okay, so anytime you're about ovulating, the body produces more mucus. Okay, and this consistency is a little watery and more elastic, and it's just to help sperm swim up to the egg in case you have a sexual activity going on or you want to be pregnant. Then there are some people that are able to track the consistency of their vaginal discharge to know exactly when they are ovulating and when they are safe. Okay, yeah. So you can also do that. You can track your consistency. You can track the type of discharge that you're having. So anytime you're having a clear and stretchy type of discharge, know that is a normal thing that comes. The type of discharge that I want to talk about is the brown vaginal discharge. This type of discharge, you mostly see it after your period or your menses. Is this normal? Absolutely yes. Why is it brown? It is brown because after your menses, there are still some, small traces of blood in there. The pH of your vagina is quite acidic, and anytime, the blood, mixes with that acidic nature, it turns to brown. So you're not supposed to see it for a prolonged period of time. So 1, 2, maximum like 3 days, you may see these traces of brown discharge, and it's normal. You don't have to necessarily take in some pills or use some topical applications of some medications, antifungal things. If, like I said, you're not having any itchiness, there's no rashes, there's no sore, and it's just a brown discharge, then this is normal, okay? So the next one is a spotting blood. This one is a little tricky, okay? So there are some times in your menstrual cycle during ovulation that you would see that spotting blood. When you see it during the time that you ovulate, then it's possible that ovulation is going on, okay? And sometimes it presents without spotting blood. If you see that spotting blood during the time that you are supposed to have your menses and it's not coming, and you see that spotting blood, then probably you may be pregnant. You may want to check it out. If it's something that occurs quite frequently and it comes with pain and irritations and other things, then you may want to head to your pharmacy or your hospital or your gynae to do some further assessment. Okay? We don't joke with some things. Sometimes your body will tell you that what you're going through is not normal. So that one, they head straight to the gynae. So when you see a yellowish or greenish discharge that is clumpy and it has a really bad odor, okay, more like a fish, then this is not normal, okay? So please see your healthcare provider, call your gynae or your doctor, okay? Let them do further assessment and treat this disease or discharge. If discharge comes with severe pain, especially at the pelvic area, then please head to your gynae. Let them do further assessment. Discharge is supposed to be painless, so when you happen to discharge with pain, then it's not normal, it's abnormal. So also, I've already talked about this, that if there's itchiness, then that's not normal, okay? It's not supposed to be itchy that you keep hemorrhaging yourself in public. That's really not normal. So when you're experiencing some form of itchiness that is you can't control yourself, then please head to your gynae, go to your pharmacy, and get your problem solved. So the last thing that I want to talk about is when there are rashes or there are some sores that comes with a discharge, okay? Or it's just there alone and you're not really seeing discharge, but you see sores and rashes, then please go to your gynae or head to the pharmacy and go for some further assessments, okay? About vaginal discharges, the fact that it's normal and it varies throughout our menstrual cycle. Some factors like ovulation, pregnancy, taking in some birth control pills, can lead to more noticeable vaginal discharges. This shouldn't cause you to panic and conclude that you're having some form of infection. So when you're having a vaginal discharge that doesn't come with itchiness or bad odor and not like a cottage cheese consistency, then it's probably a normal type of vaginal discharge. Track your cycle, know when in your cycle you're ovulating, when you're fertile, and amongst others. I thank you guys for watching this full video. If you have some inquiries or comments, or you want to find out more about vaginal discharge and you're not too comfortable commenting in the comment section, you can DM me privately, you can send an email to, and you can also check out my various social media platforms, okay, for that. And please, a gentleman, don't go to the pharmacies and hospitals and be diagnosing your wives and girlfriends of various diseases that you don't really understand, okay? The vagina is not supposed to smell like roses, anyways. Yes, so please do have a lovely day and check out my next video, which I'm talking about the causes of abnormal vaginal discharge.